Welcome to our channel. Today we're diving into 14 alarming signs that you might be lacking essential nutrients. We're talking about those vitamins and minerals that our bodies crave to function at their best. Recognizing these symptoms can be your first step towards making positive changes. It's all about connecting the dots, understanding what your body needs, and taking action to give it the fuel it deserves. Ever wonder why your gums are always swollen or bleed when you brush? It might be your diet trying to tell you something. A lack of vitamin C can wreak havoc on your oral health, leading to gingivitis and even tooth loss in severe cases. Without enough vitamin C, your gums become weak and inflamed, making them more susceptible to infection. So if you're noticing any bleeding or swelling, don't ignore it. It could be your body's way of crying out for more vitamin C-rich foods. Losing a few strands of hair is normal, but if you're noticing clumps in the drain or a thinning scalp, it's time to pay attention. One culprit could be a deficiency in essential nutrients like iron, zinc, or biotin. Iron is like the delivery service for oxygen in your body, including your hair follicles. Zinc and biotin are key players in protein synthesis, crucial for hair growth and strength. If you're experiencing excessive hair loss, it could be a sign to boost your intake of iron, zinc, and biotin-rich foods. Have you ever experienced a strange burning sensation in your feet or tongue? It might be a sign of vitamin B12 deficiency. When you're low on B12, your nerves can misfire, leading to those uncomfortable, tingling, or burning sensations. If you're experiencing this symptom, it's essential to get your B12 levels checked and talk to your doctor about incorporating more B12-rich foods into your diet. Struggling to see clearly at night? It might not just be your eyesight. It could be a sign of vitamin A deficiency. Vitamin A is essential for maintaining the health of your retinas, those light-sensitive tissues at the back of your eyes. When you're low on vitamin A, your eyes can't adjust to dim lighting as effectively, making it difficult to see clearly at night. This is known as night blindness. Talk to your doctor about getting your vitamin A levels checked and incorporating more vitamin A-rich foods into your diet. Dealing with an itchy, flaky scalp? It could be your body's way of telling you it's lacking essential B vitamins like B3, B2, and B6, as well as zinc. These nutrients play a crucial role in maintaining healthy skin, including your scalp. When you're deficient, your skin can become dry, irritated, and flaky, leading to conditions like dermatitis and dandruff. Boosting your intake of foods rich in B vitamins and zinc can help nourish your skin from the inside out. Have you noticed small rough bumps on your skin, especially on your arms, cheeks, or thighs? These bumps, known as keratosis pilaris, can be a sign of vitamins A and C deficiency. When you're low on these vitamins, your skin cells don't shed properly, leading to clogged pores and those pesky bumps. They help to keep your skin cells turning over regularly, preventing those bumps from forming in the first place. Focus on nourishing your skin from the inside out by incorporating more vitamin A and C-rich foods into your diet. Are your nails constantly breaking, splitting, or peeling? Is your hair dry, brittle, and prone to breakage? It could be a sign that you're not getting enough biotin, also known as vitamin B7. Biotin plays a crucial role in the production of keratin, a protein that gives your hair, skin, and nails their structure and resilience. When you're deficient, your hair and nails become weak and prone to damage. Biotin also plays a role in energy production and nerve function. Talk to your doctor about boosting your biotin intake through diet or supplements. Take a close look at your fingernails. Do you notice any ridges, lines, or unusual curves? While some nail irregularities are harmless, others can be a sign of nutrient deficiencies. For instance, vertical ridges running from the base to the tip of your nail can indicate iron deficiency. Spoon-shaped nails, where the nail dips inward, can be a sign of iron deficiency or low levels of protein, calcium, and vitamins A, B6, C, and D. These nutrients are all essential for nail health and overall well-being. It could be your body's way of signaling a nutrient deficiency that needs to be addressed. Have you noticed that cuts, scrapes, or wounds seem to take forever to heal? It might be a sign of vitamin D deficiency. Vitamin D plays a crucial role in regulating cell growth and repair, which are essential processes for wound healing. When you're deficient in vitamin D, your body struggles to repair damaged tissues, leading to delayed wound healing and an increased risk of infection. Talk to your doctor about getting your vitamin D levels checked and discuss ways to boost your intake through diet or supplementation. Our bones are like the framework of our bodies, providing support and protection for our organs. Weak bones can be a sign of calcium and vitamin D deficiency. Calcium is the building block of our bones, providing them with strength and rigidity. Vitamin D helps our bodies absorb and utilize calcium effectively. Make sure you're getting enough calcium and vitamin D through your diet or supplements. Experiencing persistent muscle soreness, weakness, or cramps that just won't quit. It could be your body's way of signaling a vitamin E deficiency. Vitamin E is a powerful antioxidant that helps to protect your cells from damage caused by free radicals. When you're low on vitamin E, your muscles become more susceptible to damage, leading to pain, inflammation, and slower recovery times. Consider incorporating more vitamin E-rich foods into your diet to support muscle health and recovery. Is your skin feeling dry, rough, and prone to wrinkles? It might be a sign that you're not getting enough essential fatty acids, particularly omega-6 fatty acids. Omega-6 fatty acids help to maintain the integrity of your skin's natural barrier, keeping moisture in and irritants out. When you're deficient in omega-6 fatty acids, your skin's barrier becomes compromised, leading to dryness, flakiness, and premature aging. Make sure you're incorporating enough omega-6 fatty acid-rich foods into your diet. Have you noticed that your skin has lost its healthy glow and taken on a pale, almost ghostly appearance? It might be a sign of iron deficiency anemia. Iron is a crucial component of hemoglobin, a protein found in red blood cells that carries oxygen throughout your body. When you're iron deficient, your body can't produce enough hemoglobin, leading to a decrease in oxygen delivery to your cells, including your skin cells. Talk to your doctor about getting your iron levels checked and discuss ways to boost your iron intake through diet or supplements. Are you struggling with unexplained weight gain, even though you haven't made any significant changes to your diet or exercise routine? It might be a sign of iodine deficiency, a condition that affects your thyroid gland. Iodine is an essential mineral that your thyroid gland needs to produce thyroid hormones, which regulate your metabolism, growth, and development. When you're iodine deficient, your thyroid gland can't produce enough thyroid hormones, leading to a condition called hypothyroidism. Talk to your doctor about getting your thyroid levels checked and discuss ways to boost your iodine intake through diet or supplements. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. By paying attention to your body's signals and understanding the importance of essential nutrients, you can take proactive steps towards a healthier, happier you. It's all about making those small, sustainable changes to your diet and lifestyle that can have a big impact on your overall well-being. Stay healthy and see you next time.
Welcome to Zen Zone Health. Today we're talking about those sneaky signs your body might be sending you to say it's low on essential nutrients. Stick around because this information could seriously upgrade your health game. Have you ever looked in the mirror and thought, my skin looks a little dull today? It's a common concern, and sometimes the answer isn't just about skincare products or getting more sleep. It could be your body's way of telling you it's low on key vitamins like C, B9, folate, and B12. These vitamins play a crucial role in maintaining not just your skin's health, but your overall well-being. Vitamin C, for instance, is a powerhouse antioxidant that boosts collagen production, keeping your skin plump, youthful, and radiant. It's not just about looking good, it's about your skin's structural integrity. B9 and B12 are equally important. These vitamins are crucial for the production of red blood cells, which carry oxygen to your skin and other organs. Without enough oxygen, your skin can appear dull and lifeless. When your skin lacks oxygen, it can look tired and lackluster, no matter how much you sleep or how many skincare products you use. It's always a good idea to check with your doctor to rule out other conditions, but if you're low on these vitamins, upping your intake could make a noticeable difference. Sometimes a simple blood test can reveal deficiencies you didn't even know you had. Think citrus fruits like oranges, lemons, and grapefruits for a natural boost of vitamin C. These fruits are not only delicious, but also packed with nutrients that can help rejuvenate your skin. For B9, leafy greens like spinach, kale, and broccoli are excellent choices. And for B12, lean meats, fish, and fortified cereals can be very effective. Our bodies are constantly talking to us. We just need to listen. Paying attention to these subtle signs can help you make dietary adjustments that improve not just your skin, but your overall health. Sometimes a pale complexion or dull skin is a sign that your diet needs a little more love and attention. By incorporating these essential vitamins, you can help your skin look its best and feel more vibrant. Waking up with under-eye bags? It's a common issue that many people face, and it can be quite frustrating. While it's easy to blame it on lack of sleep, there might be more to the story. One often overlooked cause is an iodine deficiency, which can significantly impact your health. Iodine is crucial for maintaining thyroid health. The thyroid gland controls your body's energy levels and metabolism. Without sufficient iodine, your thyroid can't function properly, leading to various symptoms, including puffy eyes. To ensure you're getting enough iodine, include dairy products in your diet, as well as seaweed and iodized salt. These are excellent sources of iodine. However, it's important not to overdo it with the salt. Always consult your doctor before making significant dietary changes. If you're constantly battling under-eye bags and other symptoms, it might be worth considering an iodine deficiency as a potential cause. A simple blood test can check your iodine levels, providing valuable insights into your thyroid health. Your doctor can then guide you on the best course of action, whether it's dietary adjustments or other treatments, to help you feel your best and reduce those pesky under-eye bags. Noticing bleeding gums despite good oral hygiene? This can be quite alarming and uncomfortable. It could be a sign of vitamin C deficiency, a common yet often overlooked issue. Vitamin C is crucial for immune health and wound healing. It helps in the production of collagen, which is essential for healthy gums. Low vitamin C can make gums inflamed and prone to bleeding. This can lead to discomfort and even more serious dental issues if not addressed. Load up on citrus fruits like oranges, lemons, and grapefruits. These fruits are rich in vitamin C and can help improve your gum health. Don't forget other sources like strawberries, bell peppers, and broccoli. These foods are not only delicious, but also packed with vitamin C. Eat these foods raw or lightly cooked to preserve their vitamin C content. Overcooking can destroy this vital nutrient. Healthy gums are a sign of a healthy body. Taking care of your diet can lead to a brighter smile and overall well-being. If you're noticing bleeding, it might be your body's way of asking for more vitamin C. Consult with a healthcare professional to ensure you're getting enough of this essential nutrient. If your hair is looking lackluster, brittle, or you're experiencing hair loss, consider a biotin deficiency. Biotin, or vitamin B7, is vital for metabolizing fats and proteins, essential for healthy hair. Boost your biotin intake with eggs, almonds, sweet potatoes, and mushrooms. But remember, biotin deficiency isn't always the cause of hair issues. Rule out other medical conditions with your doctor. Addressing a potential biotin deficiency could restore your hair's health and shine. Pale lips or strange cravings like ice or dirt. These could be signs of iron deficiency. Iron is essential for producing hemoglobin, which carries oxygen in your blood. Without enough iron, your body can't make enough healthy red blood cells, leading to pale lips. Strange cravings, known as pica, are another clue. Talk to your doctor if you suspect iron deficiency. A simple blood test can check your levels, and your doctor can recommend treatment. Biotin is also essential for healthy skin. Low biotin can cause rashes around the mouth, nose, and eyes. These rashes can be itchy, red, and scaly. Biotin deficiency can worsen conditions like eczema and dermatitis. Boost your biotin intake with eggs, almonds, and sweet potatoes. Not all skin rashes are the same, so consult a dermatologist for persistent issues. Leg cramps can be caused by dehydration, but also by low levels of magnesium, potassium, and calcium. These minerals are essential for muscle function. Magnesium helps relax muscles, potassium regulates contractions, and calcium is crucial for muscle function. Replenish these minerals with bananas, leafy greens, and dairy products. If you're prone to leg cramps, try gentle stretches before bed. Frequent leg cramps might indicate a need for more of these minerals. Tingling in your hands or feet could be a sign of low B vitamins, specifically B12, B9, folate, and B6. These vitamins are crucial for nerve health. They help maintain the myelin sheath, which protects nerves. Ensure you're getting enough B12 from animal products, folate from leafy greens, and B6 from bananas and potatoes. Persistent tingling should be checked by a doctor to rule out other conditions. That's it for today's video on nutrient deficiencies. By paying attention to subtle signs, you can address potential deficiencies early and keep your body running smoothly. Thanks for tuning in to Zen Zone Health. If you found this helpful, give it a thumbs up and subscribe for more health tips. Stay healthy.
Welcome to Zen Zone Health. I'm so glad you're here today. You know me, I'm all about empowering you guys to take control of your health, and today we're tackling a big one, vitamin D deficiency. Now, most people think of vitamin D as the sunshine vitamin, and while that's true to an extent, there's a lot more to it than just soaking up some rays. We're going to dive deep into why vitamin D is so crucial for your overall health, how to spot the sneaky signs and symptoms of a deficiency, and most importantly, what you can do to make sure your levels are on point. So grab your water bottle, get comfy, and let's get right into it.
All right, let's talk about skin tone. It's a fascinating subject that goes beyond just appearance. You see, melanin, the pigment that gives our skin its color, plays a huge role in vitamin D production. Melanin is not just about aesthetics. It has a functional role in our health. Now, melanin is a beautiful thing. It protects us from harmful UV rays. But here's the catch. It also acts as a natural sunscreen. This dual role of melanin is both a blessing and a challenge. What does that mean for vitamin D? Well, it means that individuals with darker skin tones might need to spend more time in the sun to produce the same amount of vitamin D as those with lighter skin. This is because the higher melanin content in darker skin acts as a barrier to UV rays, which are necessary for vitamin D synthesis. We're talking up to 10 times more sun exposure. Yes, you heard that right. This significant difference can have implications for overall health, especially in regions with less sunlight. Why is that? Think of it like this. Melanin is like a filter. The more melanin you have, the more it filters out those UV rays. And while that's great for sun protection, it also means less vitamin D production. This filtering effect is nature's way of protecting us, but it requires us to be more mindful of our sun exposure and vitamin D levels. So, if you have a darker complexion, it's crucial to be mindful of your vitamin D intake, especially if you live in areas with limited sunlight or spend a lot of time indoors. This might mean considering vitamin D supplements or making a conscious effort to get more sun exposure. Consulting with healthcare professionals can provide personalized advice on maintaining adequate vitamin D levels. Additionally, incorporating vitamin D-rich foods like fatty fish, fortified dairy products, and egg yolks into your diet can help. Remember, balance is key. While it's important to protect your skin from excessive UV exposure, it's equally important to ensure you're getting enough vitamin D. Enjoying outdoor activities safely, with appropriate sun protection, can help you strike that balance. Embrace your skin tone and take proactive steps to maintain your health. Understanding the unique needs of your skin can empower you to make informed decisions for a healthier, happier life. Stay informed, stay healthy, and celebrate the beauty of diversity in all its forms.
Ever notice how your mood tends to dip during the winter months? You're not alone. Many people experience a noticeable change in their emotional well-being as the days get shorter and the weather turns colder. This is a common phenomenon, and you guessed it, vitamin D might be playing a role. During the winter, we get less sunlight, which is a natural source of vitamin D. This can lead to a deficiency that affects our mood. See, low levels of vitamin D have been linked to mood disorders like seasonal affective disorder, or SAD. SAD is a type of depression that occurs at a specific time of year, usually in the winter, when sunlight exposure is minimal. We're talking about feeling down, losing interest in things you used to enjoy, even changes in your sleep and appetite. These symptoms can be quite debilitating and affect your daily life and overall happiness, and it all comes down to brain chemistry. Our brains rely on a delicate balance of chemicals to function properly, and vitamin D plays a crucial role in maintaining this balance. Vitamin D is thought to influence the production and regulation of serotonin, a key neurotransmitter that plays a major role in mood regulation, sleep, and even digestion. Serotonin is often referred to as the feel-good chemical because of its impact on our sense of well-being. So if you're feeling the winter blues, don't brush it off. It's important to recognize these feelings and understand that they might be linked to your vitamin D levels. It could be a sign that your vitamin D levels need a boost. Consider talking to your doctor about getting your levels checked. They might recommend supplements or dietary changes to help you get back on track. Foods rich in vitamin D, like fatty fish, fortified dairy products, and egg yolks, can also help improve your levels naturally. And don't forget the power of sunlight. Even in the winter, try to spend some time outdoors during daylight hours. A little bit of sunshine can go a long way in boosting your mood and your vitamin D levels. So, next time you're feeling down during the colder months, remember that vitamin D might be the key to lifting your spirits. Take care of your health, and your mood will follow.
As we age, our bodies go through a lot of changes, and unfortunately, vitamin D production is one of them. This essential nutrient, often referred to as the sunshine vitamin, plays a crucial role in maintaining our overall health, particularly in supporting bone health and immune function. It's a fact of life, guys. We can't escape the natural aging process, but we can certainly understand it better and take steps to mitigate its effects. You see, as we get older, our skin loses some of its efficiency in synthesizing vitamin D from sunlight. This is because the skin's ability to produce vitamin D3, the active form of the vitamin, diminishes with age. This means that even if we spend the same amount of time in the sun as we did in our younger years, our bodies might not produce as much vitamin D. It's like anything else, it just doesn't work as well as it used to. This decline in skin efficiency can lead to a host of health issues, including weakened bones, increased risk of fractures, and a compromised immune system. And it's not just our skin. Our kidneys play a crucial role in converting vitamin D into its active form. And guess what? As we age, our kidney function also declines. This means that even if our skin manages to produce some vitamin D, our kidneys might not be as effective in converting it into a form that our bodies can use. Kidney function also declines with age. This double whammy of reduced skin efficiency and declining kidney function makes it increasingly difficult for older adults to maintain adequate vitamin D levels. This double whammy makes seniors particularly vulnerable to vitamin D deficiency. The consequences of this deficiency can be severe, leading to conditions such as osteoporosis, increased susceptibility to infections, and even cardiovascular issues. In fact, studies suggest that a significant portion of the elderly population might be deficient. Research indicates that up to 50% of older adults may have insufficient levels of vitamin D, which underscores the importance of monitoring and managing this vital nutrient. So, if you're over 50, it's even more crucial to be proactive about your vitamin D levels and talk to your doctor about getting tested. Regular checkups and blood tests can help identify any deficiencies early on, allowing for timely intervention through diet, supplements, or lifestyle changes. Remember, maintaining adequate vitamin D levels is not just about bone health. It's about overall well-being and quality of life as we age.
Now, let's talk about body composition. Did you know that your weight can actually influence your vitamin D needs? Here's the deal. Vitamin D is fat-soluble, meaning it gets stored in our fat cells. So if you have a higher body fat percentage, you actually need more vitamin D to reach adequate levels in your bloodstream. Think of it like this. Imagine a sponge. The bigger the sponge, the more water it can hold, right? Same goes for vitamin D and body fat. This applies to individuals who are overweight or obese, as well as those with higher muscle mass, as muscle tissue can also store vitamin D. So if you're carrying a few extra pounds, it's worth discussing your vitamin D levels with your doctor.
We all experience aches and pains from time to time, but persistent aching, especially in your bones and muscles, could be a sign of something more serious, like a vitamin D deficiency. You see, vitamin D plays a vital role in calcium absorption, which is crucial for strong bones. When your vitamin D levels are low, your body can't absorb calcium efficiently, leading to weakened bones and even conditions like osteoporosis. Now, here's the tricky part. These aches and pains can sometimes be mistaken for other conditions, like fibromyalgia or chronic fatigue syndrome. So, if you're experiencing persistent, unexplained aches, especially in your bones, don't just brush it off. talk to your doctor and get your vitamin D levels checked.
Now this one's especially important for new parents. Excessive sweating, particularly a sweaty head in newborns, can actually be an early sign of vitamin D deficiency. It might seem strange, but it all comes down to neuromuscular irritability. When vitamin D levels are low, it can disrupt the normal functioning of nerves and muscles, leading to increased sweating. Now I know what you're thinking, babies sweat, it's normal. And you're right, but if you notice your little one is sweating more than usual, especially on their head, it's worth bringing it up with your pediatrician. Early detection and treatment of vitamin D deficiency in infants is crucial for their healthy growth and development.
Our gut health plays a vital role in our overall well-being, and you guessed it, it also affects our vitamin D levels. You see, certain gastrointestinal conditions that affect fat absorption can interfere with our body's ability to absorb vitamin D. Remember, vitamin D is fat-soluble, so if our gut isn't absorbing fats properly, it's going to affect vitamin D absorption as well. Conditions like Crohn's disease, celiac disease, and inflammatory bowel disease can all impact fat absorption and potentially lead to vitamin D deficiency. So, if you have a history of digestive issues, it's essential to talk to your doctor about your vitamin D levels and whether supplementation might be necessary.
That was a lot of information, but I hope you found it helpful. Remember, maintaining adequate vitamin D levels is crucial for your overall health, from strong bones to a balanced mood and a healthy immune system. If you suspect you might be deficient, don't hesitate to reach out to your doctor. They can order a simple blood test to check your levels and recommend the appropriate course of action, whether it's through diet, sunlight exposure, or supplementation. And hey, if you found this video helpful, give it a thumbs up, share it with your friends and family, and don't forget to subscribe to Zen Zone Health for more health tips and information. Stay healthy, everyone.
Hey everyone, welcoming you to Zen Zone Health. Now we talk a lot about vitamins here, but minerals are just as important for a healthy life. Today, we're diving into the often overlooked world of phosphorus. This essential mineral is a key player in maintaining strong bones and teeth, but it does so much more for our bodies that often goes unnoticed. Throughout this video, we'll be uncovering 7 sneaky signs of phosphorus deficiency that you absolutely shouldn't ignore. Recognizing these signs early on can make a world of difference in preventing complications down the line. Remember, knowledge is power when it comes to your health. So before we jump in, make sure to subscribe and hit that notification bell so you don't miss out on any future health tips from Zen Zone Health. Let's kick things off with a symptom that might seem pretty obvious: bone pain. We all know calcium is crucial for strong bones, right? But what many don't realize is that phosphorus plays a critical role too. It works with calcium and vitamin D to build and maintain strong bones. Think of calcium as the building blocks and phosphorus as the cement. Low phosphorus can weaken bones, causing aches and pains. This pain often appears in ribs or long bones like the thigh. That deep ache might be your body signaling for more phosphorus. Next up, let's talk about a symptom that can really throw a wrench into your day-to-day life: loss of appetite. We've all had those days where nothing on the menu sounds appealing, but if you're consistently feeling uninterested in food, it could be a sign that your body is lacking phosphorus. See, phosphorus plays a crucial role in numerous bodily functions, including how our cells use energy. When your phosphorus levels plummet, your body goes into conservation mode, trying to hold on to every last bit of this precious mineral it can. This energy conservation can manifest as a decreased appetite. Your body thinks, hey, if we're not getting enough phosphorus, let's not waste energy on digesting food. The problem is this creates a bit of a vicious cycle. You're not eating as much, so you're not replenishing your phosphorus stores, which further fuels that loss of appetite. Ever feel like you're just one minor inconvenience away from a total meltdown? We've all been there. If irritability is frequent, consider phosphorus deficiency. Phosphorus isn't just about bones and energy. It's crucial for brain function and mood regulation. Low phosphorus disrupts neurotransmitters, affecting mood and focus. This can make you more irritable or agitated, or struggle to concentrate and feel foggy-headed. These are signs of hypophosphatemia. Consult your doctor if you notice significant mood changes. Chapter 4. Changes in body weight. The phosphorus connection. Now let's talk about a symptom that often raises red flags for people. Changes in body weight. Whether you're experiencing unexpected weight gain or struggling to shed those extra pounds, phosphorus might be a factor you haven't considered. Here's the deal. Phosphorus plays a surprising role in how our bodies process food and regulate metabolism. It's involved in the breakdown of carbohydrates, fats and proteins, ensuring our bodies can utilize these nutrients effectively. When your phosphorus levels are low, it can throw your metabolism out of whack. Some people might experience weight gain due to the body's impaired ability to efficiently use energy from food. On the flip side, studies have shown that phosphorus supplementation in individuals who are obese can actually promote weight loss. That's because phosphorus contributes to feelings of fullness and satiety, preventing overeating. Chapter 5. Anxiety. Can phosphorus deficiency be the culprit? Let's be real for a moment. Anxiety has become an unwelcome companion for far too many people these days. While there are countless factors that contribute to anxiety disorders, emerging research suggests that phosphorus deficiency might be adding fuel to the fire. Think about it. We've already established that phosphorus plays a vital role in brain function and mood regulation. So, it makes sense that when your phosphorus levels are out of whack, it can impact your mental well-being. Studies have shown a correlation between low phosphorus levels and an increased risk of anxiety and panic disorders. While more research is needed to fully understand this complex relationship, the findings so far are intriguing. If you're struggling with anxiety, it's crucial to address it with your healthcare provider. They can help determine if there are any underlying nutritional deficiencies, including phosphorus, that might be contributing to your symptoms. Chapter 6. Fatigue and weakness. Unmasking the energy thief. Feeling constantly drained? Like you're dragging yourself through the day? Listen, we've all been there. But if fatigue and weakness have become your new normal, it's time to investigate whether phosphorus deficiency could be the culprit lurking behind the scenes. Remember how we talked about phosphorus being essential for energy production? Well, here's where that connection becomes crystal clear. Phosphorus plays a critical role in the formation of ATP, the primary energy currency of our cells. Imagine ATP as tiny batteries that power every single function in your body. From breathing to thinking to moving, it all requires energy from ATP. When your phosphorus levels plummet, so too does your body's ability to produce ATP efficiently. This energy shortage can leave you feeling utterly depleted even after a full night's sleep. You might find yourself struggling to power through your workouts or even simple everyday tasks. Chapter 7. Irregular heartbeats. The phosphorus heart connection. We've arrived at our final sign of phosphorus deficiency, and it's a big one: irregular heartbeats. Your heart is a remarkable organ, working tirelessly to pump blood throughout your body. And guess what? It relies on phosphorus to keep those beats steady and strong. Phosphorus plays a crucial role in maintaining the delicate balance of electrolytes in your blood, including calcium. Both phosphorus and calcium are essential for proper heart muscle function. When your phosphorus levels dip too low, it can disrupt this delicate electrolyte balance, leading to irregular heartbeats or arrhythmias. This happens because the heart requires the right balance of these minerals to contract and relax properly. Now, it's important to note that occasional heart palpitations are usually harmless and can be triggered by stress, caffeine, or even dehydration. However, if you're experiencing frequent or prolonged irregular heartbeats, especially alongside other symptoms of phosphorus deficiency, it's crucial to seek medical attention promptly. Outro: stay informed, stay healthy. That's a wrap on our deep dive into the often overlooked world of phosphorus deficiency. Remember, recognizing the signs early on is key to getting the right treatment and preventing complications down the line. From bone pain to fatigue to irregular heartbeats, the symptoms of phosphorus deficiency can be quite diverse. If you're experiencing any of the signs we discussed, don't hesitate to reach out to your healthcare provider. for personalized guidance. Don't forget to give this video a thumbs up if you found it helpful. Share it with your friends and family, and subscribe to Zen Zone Health for more empowering health insights. Stay healthy, everyone, and I'll see you in the next video.
Welcome back to Zen Zone Health. Today, we're diving deep into magnesium. Magnesium is one of the most important minerals in your body, playing a role in over 300 bodily functions. We're focusing on what happens when you don't get enough of this mighty mineral magnesium deficiency. Stick around as we break down the signs and symptoms of magnesium deficiency and how to ensure you're getting enough of this essential nutrient. One of the most common signs of magnesium deficiency is muscle cramps and twitches, especially in your legs. Magnesium regulates muscle contractions, and when you're low on it, your muscles can become overexcited, leading to painful cramps and spasms. Think of magnesium as the chill pill for your muscles, helping them relax and preventing overdrive. Without enough magnesium, your muscles are basically on a caffeine high 24/7. While muscle cramps are common, they can also be caused by dehydration or overuse. If you're experiencing frequent cramps, check in with your doctor to rule out other conditions. We all know calcium is essential for strong bones, but did you know magnesium is just as important? Magnesium helps your body absorb and use calcium effectively, ensuring it gets to your bones where it's needed most. Without enough magnesium, your body can't use calcium properly, leading to weaker bones and an increased risk of fractures. Magnesium also helps regulate bone formation by stimulating osteoblasts, the cells responsible for building new bone. So it's not just about preventing bone loss, it's also about building strong, healthy bones. If you're serious about bone health, make sure you're getting enough magnesium too. Magnesium plays a critical role in keeping our minds sharp and emotions balanced. It's a natural mood booster, and when you're deficient, it can take a toll on your mental well-being, causing feelings of anxiety and irritability. Magnesium helps regulate neurotransmitters, the chemical messengers in our brains that control mood, sleep, appetite, and concentration. If you're feeling constantly stressed or anxious, a lack of magnesium could be a contributing factor. High blood pressure, or hypertension, is a serious condition affecting millions worldwide. Magnesium acts as a natural vasodilator, helping relax blood vessels and lower blood pressure. Studies show that people who consume higher amounts of magnesium tend to have lower blood pressure. Magnesium can also improve other markers of heart health, like cholesterol levels. If you're concerned about your heart health or have hypertension, talk to your doctor about increasing your magnesium intake. It could make a world of difference. We've all felt that overwhelming sense of fatigue, both physically and mentally. While there are many potential causes of fatigue, magnesium deficiency is often overlooked. Magnesium plays a vital role in energy production at a cellular level. Without it, your cells can't produce energy efficiently, leading to fatigue and weakness. If you're constantly feeling exhausted, even after a good night's sleep, consider getting your magnesium levels checked. It might be the missing link to your energy levels. Magnesium is crucial for regulating the electrical activity of the heart. It helps control the balance of electrolytes like potassium and calcium, essential for generating the electrical impulses that make your heart beat. When magnesium levels are low, this balance can be disrupted, leading to irregular heartbeats or arrhythmias. These arrhythmias can range from harmless palpitations to more serious conditions like atrial fibrillation. Ensure you're getting enough magnesium, especially if you have pre-existing heart conditions. For anyone who suffers from asthma, magnesium might be a valuable ally in managing symptoms. Magnesium helps relax the muscles in the airways of our lungs, making it easier to breathe. When magnesium levels are low, these airway muscles can constrict, making it harder to get air in and out of the lungs. Magnesium sulfate is often used in hospitals as a treatment for severe asthma attacks. Increasing magnesium intake through diet or supplements might help reduce the frequency and severity of asthma attacks. That's a wrap on magnesium. We've covered a lot of ground today, from muscle cramps and bone health to mental well-being and heart health. Magnesium is one essential mineral you don't want to overlook. A balanced diet rich in magnesium-rich foods like leafy greens, nuts, seeds, and dark chocolate can prevent deficiency. If you're concerned about your magnesium levels, talk to your doctor for a simple blood test and recommendations. Don't forget to like this video and hit that subscribe button for more health and wellness tips. Until next time, stay healthy and take care.
Welcome back to Zen Zone Health, your go-to for straightforward health advice. You know, we often talk about vitamins, but today we're diving into a crucial mineral, potassium. It's essential for a healthy heart, strong muscles, and even your mood. Now, many people don't even realize they're low on potassium until it hits them hard. So, in this video, we'll uncover 8 sneaky signs your body might be sending you, signaling you need more potassium in your diet. Make sure to subscribe to our channel and hit that notification bell so you never miss out on vital health tips and advice. Feeling a little short of breath lately? You might brush it off as nothing, but it could be a sign of potassium deficiency. You see, potassium plays a key role in how our lungs work. It helps those muscles contract and expand properly so you can breathe easily. When you're low on potassium, those muscles struggle and you might find it harder to catch your breath. In severe cases, it can even lead to abnormal heart rhythms and potential damage to your lungs. So if you're experiencing any unusual breathing difficulties, it's always best to get it checked out by a healthcare professional. Ever wake up feeling like you ran a marathon even though you just rolled out of bed? That muscle stiffness could be another sign of low potassium. Potassium acts like a delivery service, ensuring a steady flow of blood packed with oxygen reaches your muscles. When you're deficient, your muscles are literally starved of the oxygen they need to function correctly, leading to that stiff, achy feeling. Now, it's important to remember that muscle stiffness can also be caused by other factors like overexertion or even the flu. So if you're experiencing persistent stiffness, don't hesitate to consult your doctor to rule out any underlying conditions. Feeling constantly drained, like you're running on empty? We've all been there, but if fatigue becomes a regular visitor in your life, it's time to listen to your body. As we discussed, potassium is vital for delivering oxygen to your muscles, and without enough of it, your energy levels plummet. Think of it like this. Your body is like a car and potassium is the fuel. No fuel, no go. Plus, when your potassium is low, your heart has to work overtime to compensate, further draining your energy reserves. So if you're constantly hitting the snooze button or feeling wiped out for no apparent reason, a potassium deficiency could be the culprit. Chapter 4. Issues with heartbeat. Now, this next sign is a bit more serious and can have significant implications for your overall health. Potassium plays a crucial role in maintaining a healthy heart rhythm, ensuring that your heart beats in a regular and coordinated manner. When your potassium levels drop, your heart might start acting up, beating too fast, too slow, or irregularly. This can be quite unsettling and may cause noticeable symptoms. These irregular heartbeats, known as arrhythmias, can be quite alarming and may even lead to more serious cardiac issues down the line, such as heart attacks or heart failure. Interestingly, there's a strong link between low potassium, anxiety, depression, and stress. These mental health conditions can exacerbate the physical symptoms. It's like a vicious cycle. Low potassium can worsen these mental health conditions, and in turn, stress can deplete your potassium levels even further, creating a feedback loop that's hard to break. The good news is that maintaining healthy potassium levels through a balanced diet rich in potassium-rich foods like bananas, oranges, and leafy greens can go a long way in preventing these heart issues and improving your overall well-being. Chapter 5. Feeling numb. Ever experience that pins and needles sensation in your hands, feet, or even your face? While it can be harmless and temporary, persistent numbness, especially in the extremities, should never be ignored. Potassium is like a messenger transmitting nerve signals throughout your body. When your potassium levels are low, those messages get disrupted, leading to numbness and tingling sensations. Think of it like a faulty wire connection. The signal just doesn't get through properly. If you're experiencing persistent numbness, don't try to tough it out. It's crucial to consult your doctor to determine the underlying cause and receive appropriate treatment. Chapter 6. Cramps. We've all been there, those sudden painful muscle cramps that seem to come out of nowhere, especially during or after exercise. While dehydration is often the culprit, low potassium levels can also be a major contributor to those muscle spasms. Remember how potassium helps regulate muscle contractions? Well, when your potassium is low, those contractions can become irregular and downright painful. If you're experiencing frequent muscle cramps, it's essential to stay hydrated and ensure you're getting enough potassium in your diet. And, as always, if the cramps are severe or persistent, don't hesitate to seek medical advice. Chapter 7. Mood swings. Feeling like you're on an emotional roller coaster, swinging from happy to sad to irritable in a matter of minutes? It's a common experience for many people. While mood swings can be triggered by various factors, including hormonal changes and stress, a potassium deficiency might be playing a role behind the scenes. Potassium is a crucial mineral that our bodies need. Potassium is essential for maintaining not just physical health, but also mental well-being. It helps in regulating fluid balance, muscle contractions, and nerve signals. When your potassium levels are low, it can disrupt the delicate balance of electrolytes in your brain, which are vital for proper brain function. This imbalance can lead to mood swings, irritability, and even feelings of anxiety or depression. It's like your brain is sending mixed signals. It's like your brain isn't getting the right signals, leading to emotional turmoil. You might feel out of control and unsure of why your emotions are fluctuating so wildly. While more research is needed to fully understand the link between potassium and mental health, the evidence so far is compelling. Maintaining healthy potassium levels through a balanced diet, rich in fruits and vegetables, may help promote emotional stability and overall well-being. So next time you feel those mood swings, consider if your diet might be a factor. Chapter 8. Constipation. Let's talk about something nobody really enjoys discussing: constipation. It's a common issue that affects people of all ages and backgrounds. We've all been there, and it's not fun. The discomfort and frustration can really impact your daily life. While there are many causes of constipation, from dehydration to low fiber intake, did you know that potassium deficiency could be a contributing factor? It's something many people overlook. Potassium plays a vital role in muscle function, and that includes the muscles in your digestive system that help move things along. These muscles need potassium to contract properly. When your potassium levels are low, those muscles don't contract as efficiently, leading to slow digestion and, you guessed it, constipation. This can make you feel bloated and uncomfortable. If you're experiencing persistent constipation, it's essential to stay hydrated, increase your fiber intake, and ensure you're getting enough potassium in your diet. Foods like bananas, oranges, and leafy greens are great sources. And as always, if you have any concerns, don't hesitate to reach out to your doctor. They can provide personalized advice and help you find relief. Outro 8 signs you have potassium deficiency. Zen Zone Health. So there you have it. 8 potential signs that you might not be getting enough potassium. Remember, your health is your wealth, and paying attention to your body's signals is crucial. If you're experiencing any of these symptoms, don't ignore them. Talk to your doctor to rule out any underlying conditions and discuss ways to increase your potassium intake through diet or, if necessary, supplementation. Don't forget to give this video a thumbs up if you found it helpful, and subscribe to Zen Zone Health for more health tips and advice. Stay healthy, and I'll see you in the next video.
Welcome to Zen Zone Health. Today, we're unlocking the power of a true health superhero, selenium. This mighty mineral plays a critical role in keeping your body running smoothly. From supporting your immune system to keeping your thyroid functioning optimally, selenium does it all. If you're ready to learn how to optimize your health with this amazing mineral, hit that subscribe button and stick with me.
So, let's get down to basics. What exactly is selenium? It's a trace mineral, meaning your body only needs a tiny amount, but its impact is mighty. Think of selenium as a vital spark plug for your cells. Selenium is a key component of selenoproteins, which act as antioxidants, fighting off harmful free radicals. This means selenium is your shield against oxidative stress, linked to aging and chronic diseases. Pretty impressive for a trace mineral, right?
Now you might be wondering, how much selenium do I actually need? The recommended daily allowance for adults is around 55 micrograms. Your individual needs might be higher or lower, depending on factors like age, health, and location.
pregnant women and breastfeeding mums, your selenium needs are a bit higher. It's always best to talk to your doctor to figure out the right amount for you. Remember, too much of a good thing can be a bad thing.
Feeling a little foggy lately? A selenium deficiency could be a contributing factor, especially as we age. Selenium plays a role in maintaining cognitive function and protecting your brain from oxidative stress. Studies have shown a link between selenium deficiency and a higher risk of cognitive decline and even Alzheimer's disease. If you're experiencing brain fog or memory problems, it's worth talking to your doctor about getting your selenium levels checked.
Selenium is crucial for muscle health, especially for your heart, the hardest working muscle in your body. When your selenium levels are low, your muscles, including your heart, can become weak and fatigued. A severe selenium deficiency can even lead to Keshan disease, which primarily affects the heart muscle and can be life-threatening. Don't panic. Keshan disease is rare, but it highlights just how important selenium is for muscle health. If you're experiencing unexplained muscle weakness or fatigue, talk to your doctor.
Let's talk about the thyroid for a moment. Your thyroid is like your body's tiny but mighty energy control center. Selenium plays a crucial role in keeping it functioning properly. When your selenium levels are low, your thyroid can't produce hormones efficiently, leading to hypothyroidism. One of the common symptoms of hypothyroidism? Weight gain. If you're struggling with unexplained weight gain, it could be linked to a selenium deficiency and an underactive thyroid.
Studies have shown a link between higher selenium levels and a lower risk of certain cancers like prostate, lung, and colorectal cancer. This is likely because of selenium's powerful antioxidant properties, which help protect your cells from damage that can lead to cancer. But more research is needed. We can't rely solely on selenium supplements to prevent cancer. A healthy lifestyle, including a balanced diet and regular exercise, is still crucial. If you're concerned about cancer risk, talk to your doctor about your individual risk factors.
Noticed more hair in your brush than usual? Selenium might be playing a role. Selenium is essential for healthy hair growth. It helps your body process iodine, crucial for hair follicle function. When your selenium levels are low, your hair follicles don't get the nutrients they need, leading to hair loss and changes in hair texture. And it's not just your hair, your nails can also become brittle and weak. If you're noticing changes in your hair or nails, it could be a sign of a selenium deficiency. We talked about the thyroid earlier, but let's dive deeper into how selenium impacts this vital gland. Selenium is crucial for the production of thyroid hormones, specifically T3, the active form of thyroid hormone. When your selenium levels are low, your body can't produce enough T3, leading to hypothyroidism. Hypothyroidism can cause symptoms like fatigue, weight gain, depression, and dry skin. It's important to catch hypothyroidism early because it can lead to more serious health problems.
Let's talk about immunity. Your immune system is your body's natural defense system. Selenium plays a crucial role in keeping your immune system strong and resilient. It boosts the activity of certain immune cells, like natural killer cells and T cells. When your selenium levels are low, your immune system is compromised, making you more susceptible to infections.
Ever noticed that your cuts and scrapes seem to take forever to heal? Selenium could be a factor. Selenium plays a crucial role in tissue repair and wound healing. It helps reduce inflammation, which is your body's natural response to injury. But inflammation can also delay healing if it's excessive or prolonged. Selenium helps keep inflammation in check, allowing your body to focus on rebuilding damaged tissue.
Do you feel like you're constantly battling a cold or the flu? A selenium deficiency could be contributing to your susceptibility. Selenium plays a crucial role in immune system communication. When your selenium levels are low, your immune cells can't communicate effectively, making it harder for your body to fight off infections. This means you're more likely to get sick, and your symptoms might be more severe and last longer.
For those trying to conceive or currently pregnant, listen up. Selenium is crucial for reproductive health for both men and women. For men, selenium is essential for healthy sperm production and motility. For women, selenium is essential for healthy ovulation, implantation, and a healthy pregnancy. It helps protect the developing fetus from oxidative stress and ensures proper thyroid hormone production. If you're experiencing fertility issues, it's worth talking to your doctor about your selenium levels.
Feeling tired all the time? Fatigue is a common symptom of selenium deficiency, often linked to its impact on thyroid function. Selenium is essential for thyroid hormone production. When your selenium levels are low, your thyroid can't produce enough thyroid hormone, leading to hypothyroidism. And guess what one of the hallmark symptoms of hypothyroidism is? Fatigue. If you're constantly feeling wiped out, it could be a sign of a selenium deficiency and an underactive thyroid.
Thanks for sticking with me, everyone. We've covered a lot of ground today, but I hope you've gained a newfound appreciation for the power of selenium. This mighty mineral truly is essential for your overall health and well-being. Remember, while selenium is important, it's not a magic bullet. A healthy lifestyle is still crucial. Don't forget to like, share, and subscribe for more health tips and insights. Stay healthy and see you in the next video.